I believe strongly in augmenting the body and the micronutrients and certain supplements that we need in order for our chemistry set to work right. Over the years, we've come and gone through numerous different supplements and vitamins and minerals. And I'm just give you a second here. In 2 years, some of these won't be here. Some of them will still be here because some of them have been here for many years. Magnesium. Remember, the eye is brain tissue, and we all need to circulate, and we need to have all the proper nutrients and minerals in order for our cells to work right. Magnesium oil, vitamin D and its different forms, Memory Plus, because we work with concussions and cognitive issues. When someone has a head strike and their eyes are affected, then we have to institute all the different alternative things we do in introducing the magnetic fields and ozone, but memory, a number of different things that we don't have here, CoQ10 and some other aspects. I can send you to the drugstore for those. This is the granddaddy of supplements made by Dr. Tennant, an ophthalmologist who has successfully treated thousands and thousands of patients with macular degeneration in his lines of products. Ozone, we use it many, many ways. A drop that goes in the eye with castor oil with ozone for the severe dry eye patient and the person who wants to have a better tomorrow by putting a drop in their eye tonight. Nitric oxide in a couple different forms. We have lozenges and a topical. I'm a fan of CBD and the endocannabinoid system that we have in our body, that when you take CBD, and it does not have to have THC in it, but you're going to work on inflammation, pain, anxiety, and sleep. And those things are beneficial for patients as it goes with fixing the gut, brain, body, eye. I perform orthokeratology, corneal molding. We have a number of different drops that people use when they're reducing their prescription through overnight wear of lenses. Ocufolin and its co-product ifolate, believe heavily in Ocufolin because it improves circulation, improves perfusion, and reduces venous pressure. A couple different forms of oils, a plant-based oil and a fish-based oil. Mushrooms. Why mushrooms? Why does the eye doctor have mushrooms? Well, because the beta-glucans that are in mushrooms are neuroregenerative. They increase neuroplasticity. Proven that the patient with multiple sclerosis, which can make you go blind, and other neurodegenerative diseases benefit by the use of mushrooms. I'm a forager. I go out in the woods and I know which handful of mushrooms I like. And just remember, every mushroom is edible, but some are only edible once. And some more ozone-related products and other supplements we have here. So there are recommendations. No one is required to do any of these things. We write tons of prescriptions and send lots of things out to the typical pharmacy, but there's a lot of things you can do outside of RX pharmacy that's going to improve your gut, brain, body, eye.